have the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
Welcome to Pure Dog Talk. I am your host, Laura Reeves, and as always, our favorite veterinarian is here, Dr. Marty Greer. And I had a special request. Actually, a friend of mine called me on the phone and said, oh my God, this horrible thing is happening. And they were losing puppies from a litter. They just, someone who's been breeding at the highest level for 40 years and had never experienced this. And so I said, okay, we will do the herpes and brucellosis conversation again. And so that's what Marty and I are going to talk about today. It is terrible and horrifying, and particularly when you're someone who's been doing it for a long, long time and never encountered these kinds of problems. So welcome, Marty.
Thank you. Thanks for having me. And I bet you say favorite veterinarian to all your veterinary guests.
No, that's not true. No, favorite veterinarian is reserved only for Dr. Marty.
Okay. All right. Because there are some really great veterinarians.
There are some wonderful veterinarians, and many of them have enlightened me on many outstanding things. But,
absolutely.
Not all of them are willing to give up a day of their life to be on my podcast once a month. So that's how you get the favorite status.
Well, it doesn't take a whole day. I don't really do any, I don't do preparation for this because this is just what I talk about every day.
It's your daily, I know. But that's, I think, and for those of you out there who have not heard, Marty and I have started the Marty and Laura show, which sort of is our spinoff on Veterinary Voice, from Pure Dog Talk to talk to our puppy buyers, right? Talk to the average person out there who just happens to own a dog or a cat or a gerbil or whatever. And part of what we have built on is the friendship and the relationship that we've built here at Pure Dog Talk. So,
yep, for sure. So we do try to have a lot of fun, and
even though we're talking about a really yucky thing today.
Yeah, but it's more fun to be spontaneous than it is to be scripted. So Here we go.
Talk to me. Let's actually start with brucellosis, because it's really scary. It's been sort of reinvigorated or reintroduced thanks to the imported street dogs from wherever in the world they've been imported. So let's talk about that a little bit.
Sure. And I think what I want to preface any remarks with is the literature says anywhere between 10 and 40% of puppies that are conceived, somewhere between conception and weaning, die, which is a huge number. And that means along the way, you may have never lost a puppy. And then when you do, it's catastrophic, especially if you lose an entire litter. It's absolutely catastrophic, financially, emotionally. For the bitch, I talked to a person yesterday who had lost a whole litter, and her bitch did what my bitch had done, because I've lost a whole litter at one point in my breeding career. And this poor dog, my dog and hers, in the middle of the night would just wail, this mournful wail, looking for puppies. So it's horrible. Yeah. It's not just about
it's same thing. I lost an entire litter to whatever, it was. And my poor bitch, we C-sectioned her. We C-sectioned 9 puppies, perfectly formed, that never lived, never took a breath.
Yep.
And it was 5 or 6 days later that she'd actually been due. And she was in her whelping box because she was recovering from the C-section. And on the day that she was due, she went bananas. She lost her mind, and she ran around and gathered up 9. And I am not kidding. And it makes me cry to this day. 9 stuffed animals, and put them in the box with her and tried to make them nurse, and threw them in the air and cried, trying to make them live.
Yeah. It's horrible. So it's not just about our emotion. We really have to address the fact that our dogs go through a very difficult time, and it's financially devastating, especially if you've used resources like limited amount of frozen semen, and you've put a lot of money into the breeding, you've put a lot of money into the bitch. It's all along the way. There's nothing that is good about anything that happens, other than you need to pull yourself up by your bootstraps and say, I am going to learn from this, and I'm not going to let this happen to me again, because I'm going to learn this lesson. Mother Nature is a wicked teacher. She'll give us
Bitch.
a lesson.
The bitch.
She is. Yeah. So we have to acknowledge that it's just all the way around, and it's difficult for your veterinary clinic. They're upset too. So there's nothing good that comes of this, other than you'd better learn from it and try your very best not to let it happen again, which is the conversation I had with the client yesterday. So, I'm going to, my next thing before we really jump into brucellosis per se is to say, if you lose even a single puppy in a litter, not just the entire litter, but a single puppy, that you have testing done on that puppy, you have a necropsy done of some form at your vet clinic or at a referral center or at a reference lab, that you find out what happened, because you can't learn from it if you bury your mistakes. If you pop them in the freezer, if you bury them in the yard, you can't learn anything, and you can't move your breeding program forward until you know what happened. And there is no diagnosis of fading puppy syndrome. So if your vet says that's what you have, you need to find another vet or dig a little harder with the one you're working with, because you need to find out what happened. And your vet can certainly do a necropsy on the puppy, open it up and take a look. If they are not comfortable with it, or you need additional diagnostics like virology and cultures and so forth, you should send the puppies to a diagnostic lab. And I'm going to say right here and now that every state has a diagnostic lab. Every diagnostic lab has strengths and weaknesses. There's, of course, Antec, IDEX, Zoetis, the big ones. But I'm going to tell you, Wisconsin's veterinary diagnostic lab, which you don't have to be from Wisconsin to use, but you do have to have a veterinarian signature on the paperwork, does the best job of getting us a report back on infectious diseases within 48 hours of the time that they receive the puppy. So if you lose somebody, you need to know, is there something infectious, as quickly as possible. Now, they don't get the full report out for sometimes 2 weeks, but if you have an infectious disease, if you have brucellosis, if you have herpes, if you have distemper, adeno, parvo, any of those things, they can very rapidly help you get a diagnosis so that you can then turn around and address the needs of the other puppies in that litter before you lose more puppies. So I've seen diagnostic tests from all the diagnostic labs. I have them sent to me from a number of places because I talk to breeders everywhere. And I'll tell you that all the ones that I've seen, Wisconsin's is the best. And you get 12 diagnostic virology and bacterial disorders tested for, results back in 48 hours. So Wisconsin Veterinary Diagnostic Lab, you go to the website. If your vet doesn't use them, go to the website, print off the form, trot into the vet clinic with the form in your hand, the puppy in a box, and overnight ship that puppy to that diagnostic lab and get an answer.
Okay. So with brucellosis specifically, so we're going to try and do this in order. Give us signs and symptoms. What are they going to see? When are they going to see it? And if that's what it is, then what? Like, what happens, right? Like, what happens to your stud dog? What happens to other bitches that dog might have bred at or near the same time? I mean, this is all a cascading thing.
Right. And interestingly, without knowing I was going to do anything with reproduction, my senior paper when I was in vet school was on canine brucellosis. So I remember writing this paper, and this was in 1980. So brucellosis hasn't gone away. There's no vaccine for it. So yes, you can have anything from a normal looking bitch and a normal looking stud dog to a stud dog that has inflamed testicles, that he's sick, he's infertile, sterile, along the way, whatever that happens to be. You can see normal adult dogs develop brucellosis symptoms. They can be uveitis, which is inflammation of the eye. They can be discospondylitis, which is inflammation of a disc. So if you go into the go in for a diagnosis at your vet clinic and you have certain symptoms, even in a normal dog that isn't a breeding dog, they may test for brucellosis because it can cause other diseases. And then in bitches, we can see anything from apparent infertility, where she looks like she didn't conceive, but she actually conceived and lost the litter, to puppies that are born weak that die shortly thereafter, puppies that are born normal and die afterwards, bitches that have infertility. Any of those things can look like brucellosis. And it is spread through venereal spread, which is male to female breeding, but it can be spread through any body fluid. So urine, placentas, all those things. When you're handling placentas at your own whelping, you should be wearing exam gloves to protect yourself, just in case there's any possibility. And brucellosis survives freezing semen, so it doesn't even get killed at that negative 300 degrees that we see semen frozen at. So you need to be aware that dogs
I'm not sure I knew that.
Yeah, there was a case at Cornell that they diagnosed a bitch that had brucellosis from frozen semen. So you need to be aware that when we say you should test for brucellosis, we're not joking around. You should test for brucellosis. And it's a zoonotic disease, meaning people can get it as well. So especially if you have a woman who's pregnant or someone who's very young or immunocompromised because of medications that they're on or cancer therapy or that they're elderly or whatever, people can get this disease. When I was in undergrad, I worked at a human hospital and I drew blood on patients. I was a phlebotomist. I was the vampire that went to the patient rooms and drew blood samples. And one of the patients that I was drawing blood samples on was getting blood cultures done. He was a veterinarian that had brucellosis. He'd gotten it from inadvertently injecting himself with what was called the Bangs vaccine back in the old days. That was the cattle vaccine. And he ended up with brucellosis. And I was drawing blood on him when he would spike a fever to see if we could culture brucellosis. And I saw this guy. I mean, I drew his blood. He was one sick dude. Let me tell you, you don't want brucellosis because once you get it, it lives in your bone marrow and it's in your body forever. There's no way to get rid of it. So this is a disease that we take seriously enough that it is a reportable disease in many states, meaning that if you have a positive dog, the state veterinarian has the authority to knock on your door, quarantine your kennel, lock you down, and for 30 days or every 30 days for 3 tests, so a total of 90 days, they will come back, have your dog sampled, and anybody that's persistently positive will be euthanized. So this will end a breeding program. If you've been breeding for 40 or 50 years and you get brucellosis in your kennel, poof, your line is gone. So take this seriously.
Okay. And I think it's important. One of the things that some of my other conversations on this topic has brought to my attention that I guess I didn't know before, and you kind of alluded to it here, the dog, it doesn't have to have been mated. It can pick it up at the dog show or the dog park or beside the road at a rest stop.
Right. Or the mother could have had it. So it could have had it as a puppy and been harboring it. So yes, there are other body fluids that this can happen through. So it's most frequently seen in mating, but not exclusively. So you want to just be aware of that. And currently, there is no USDA approved brucellosis test for use in a veterinary clinic.
Yeah.
So I think it's...
Expand on this because this is the one that I just can't even get my head around.
Yeah. So the test that we've had for 40 years, it was made at one time by Pittman Moore, which then became SmithKline, which then became SmithKline Beecham, which then became Pfizer, which then became Zoetis, and then they pulled it off the market about 5 years ago. We no longer have a USDA in-house veterinary brucellosis canine test. So if your vet is running one in-house, either the test kit is expired or they're buying the one from China. And if you call the company, which I did, and ask them if it's USDA approved, they will tell you no. They're honest about it, so that's okay. You can buy this test yourself. You can run it yourself. You can run it at your vet clinic, but we don't recommend it because USDA is not verified that these positive and negative controls are actually valid. So you should be planning ahead far enough ahead of your breeding that you go in, have the blood sample drawn and sent to either your state diagnostic lab or one of the other diagnostic labs that's approved. And if you're curious about this enough to take a look, the Society for Theriogenology has a webpage up about this that shows what the diagnostic labs that are approved are, and they don't happen to be some of the bigger labs that your vet clinic may be frequently using. So
they're not using IDEX and some of those?
IDEX and Antex tests, we don't have any validation on currently. So we don't really know what to tell you about those test results. So you should be using a diagnostic lab that uses negative and positive controls that has verified that those samples are accurate. The results of the testing is accurate. So just be aware. Now that the old test kit used to have a fairly high percentage, up to 10% of false positives, which would always, raise your blood pressure a little bit. There was a second test that was run inside the kit if you needed to do it that came back. If it was negative, then you were still a negative. It came back positive on both tests. Then you had to send to Cornell. And currently Cornell is considered, their multiplex test is considered the most appropriate test to be running. So be aware of that. But there are other diagnostic labs that are currently looking at developing tests. So if somebody's listening to this and it's out of date, then you want to check the Society for Theriogenology, go to the position statements.
I'll put a link
So go
up.
to go to Society for Theriogenology, the position statement, go to brucellosis, and all that information is there. And I happen to know that was done because I raised my hand at a meeting a couple of years ago and said, I'm a little concerned about this. And they said, yeah, that's a good idea. Let's put together a committee. You're in charge. So I put some people on my committee that are boarded in Therio and one that developed a PCR test. And so we had some really good resources. It wasn't Marty Greer's decision to make. It was that I had some really good people on the committee that have put together something, and it will need to be updated as tests change, but that's the current thinking, is that you should not be doing those. And I've actually run the test because one of my clients bought it and brought it in and said, can you show me how to run this? I'm like, yeah, but it's not USDA approved. And she said, well, I didn't know that. Well, it's not. So that's the harsh reality, is your vet clinic cannot give you results in 20 minutes with a USDA approved test. It has to be sent out, and it's going to take at least a week to get a result. So don't wait until the day.
Yeah. It needs to be done a week or two in advance, right?
Yes. So before she comes into heat, before you're going to use them, this is why you need to make some plans in advance, is so that at the last minute, you're not running around like a crazy person.
Yep. Okay. And I think that, do you have the statistics? I've seen them somewhere, and if you don't have them on the top of your head, I'll try and track them down for the blog post. But the increased number of brucellosis cases in the last 5 or 10 years that I've been attributed to imports.
Yeah, I don't have that number, and some of them are imports, some of them are not. There's still dogs in the country that I've spoken to owners of and breeders that have had dogs come through their facilities, or dogs that they've used in their facilities that are Brucella positive, and it's pretty devastating. So it's not a disease that's been eradicated, and it is something you need to be aware of because it can happen. And just because you think it's not an imported dog doesn't mean for sure that you're safe. So don't take any chances. Just spend the money, spend the $100 and get the brucellosis test done.
Okay, next up, herpes. I know we've talked about herpes a number of times here on the podcast, and I just feel like, 675 episodes, somebody might have missed that one. So we're going to do it again.
That can happen. So herpes is a virus that in the adult dog causes mild symptoms of upper respiratory, basically kennel cough. But it looks like every other kennel cough. It looks like Bordetella, adenovirus, coronavirus, parainfluenza. There's a whole list of diseases that can look very much like it, and it can be very difficult to distinguish without testing. And so influenza, most people don't test their dog when they have kennel cough. They just go, well, yeah, here's some antibiotics. You may or may not need those depending on if it's bacterial or viral with a secondary bacterial infection. But a lot of people will use them, and we just don't always know that this is herpes or not herpes. So if I have a litter of puppies at my house and I'm treating a dog that has kennel cough, you should see us in lockdown. We walk in the door, of the garage, the clothes never come into the house. The clothes go directly into the washer and dryer. Dan and I go straight to the shower, and we just don't take any chances because you can very easily bring it home. And this is probably the one disease that I would say to people, you should probably not take a pregnant dog to a dog show, or you should probably not go to a dog show and bring home a dog because of the possibility of bringing herpes home. Now, that's really the only disease that I'm concerned about people bringing home and causing a problem with. And it doesn't happen often, but when it happens, again, it's pretty devastating. You can lose an entire litter. Herpes is an interesting virus because in the adult dog, it only causes mild respiratory disease, but herpes lives in tissues that are below body temperature. So that's why cold sores are on your lips and other parts of your body that are external. The herpes lesions never go away. When you get them, they're always going to be there. They'll flare up from time to time, and the same thing happens in dogs. So we can certainly see dogs that can harbor it and have very minor problems. But when it happens in a puppy, which body temperature is 96 to 99, it's not over 100 degrees. That's why puppies under 2 weeks of age get so sick and can die from it. So again, we can see apparent infertility or apparent failure to conceive in a bitch that lost a litter really early in her pregnancy. We can see her having an infection in late pregnancy and delivering puppies that are either deceased or just die shortly thereafter. Or we can see puppies up to 14 days of age that get really sick and die. And there's two really characteristic things that happen with herpes in these young puppies. One is as they're dying, they have this very characteristic, sad, mournful mewing sound that they make. It's absolutely heart-wrenching to hear, and it's not only upsetting to you, but upsetting to your bitch. And then if you lose a puppy, this is why I'm going to say to you, your vet clinic should open up that puppy. I've actually taught one class to clients in doing their own postmortems, but this isn't something that appeals to most people, is take your puppy to the vet if you lose it, have them open it up. And there's pictures in the book. We can put pictures on the website. There's a very characteristic lesion that's seen on the kidneys and especially the kidneys of these puppies, that they'll have these red petechial spots, these red spots on their kidney, which is almost pathognomonic for herpes. Like if you see that, it's almost a guarantee that herpes is going to be found in that puppy.
For some reason,
Kidney.
I had that in my mind that was on the liver, but it's on the kidneys that you're going to see that.
The liver's already kind of that color, but the kidneys will have a very characteristic pattern. So I'll send you some pictures that we can put up, but basically that's the lesion that your vet can see even without sending the puppy to a diagnostic lab. You can see those lesions and have a pretty good idea that you have herpes, in which case that means you need to raise the temperature in the incubator where the puppies are being kept, because you're going to have to keep them above 100 degrees. You may find that acyclovir, which is an antiviral drug, some people will use that. There's information in the Canine Reproduction and Neonatology book on that, and information on VIN if your vet needs it. And then plasma, frozen plasma from a dog that comes from like Animal Blood Resources, since Hemopet is no longer able to ship us plasma. Animal Blood Resources can ship plasma, or you can take plasma from one of your dogs in your kennel, have your vet draw blood, sample it, and then turn it into something that will be plasma that you can give to the puppies by sub-Q injection or IV injection. So that's your best bet in trying to save them, because it is a virus. There's not an antibiotic that's going to help with this. So that's the challenge, is you have to react pretty quickly, because you can lose an entire litter in a very short time period.
Yeah, and I think that the one litter that I had where I couldn't get my vet to do the necropsy, but I suspected it. And I had one puppy that lived in an incubator until he was 4 weeks old. Like he couldn't, and every time I'd take him out, he'd crash. Okay, so prevention on any of this stuff. What are our best preventive options for either brucellosis or canine herpes virus?
So for brucellosis, it's testing the adult dogs before you breed. For herpes, the problem with herpes is that the titer tends to rise and fall fairly quickly. So you may not find a positive titer on a dog, even if she was infected. You may not find it. And we used to say that if a bitch had ever had herpes in her lifetime, she would have lifetime immunity. But John Verstegen published a paper that showed that probably wasn't the case. So you could potentially have it happen to the same bitch's litters on more than one occasion. So yeah, so if you're going to a dog show, quarantine the dogs so that they're not back in the same part of the house or facility where the pregnant dog is. You change your shoes before you come into the house. We wear Crocs, a lot of Crocs, because you can throw those in the washing machine along with your clothes, and but don't put your Crocs in the dryer. My husband did that to a pair of mine that were lined, and they turned into little elf shoes. So don't throw your Crocs in the dryer, but do throw them in the washing machine.
Or
and
just
do disinfect them.
ban Crocs and wear Keds, because I'm just saying.
Keds are fine.
Sure.
Oh, yeah, I know. I just saw an ad for Skechers. Skechers now has a waterproof / washable shoe.
Yes.
So, wear something that's washable. Those cute little flats that you wear to the dog show probably aren't going to be very washable. So think about what you're wearing for shoes.
Yeah.
Yeah. And don't let people in your house that you don't know what their dog's at home status would be.
A lot of us over the course of time get more or less focused on our biosecurity, if you will, when we have pregnant dogs. And I think that, that when you start and you look around and you see some of this, you get really mental about it.
Right. I mean, women are pregnant for 9 months and they don't stay in their house for the 9 months that they're pregnant, except during COVID when nobody went anywhere except for us because we were just talking about this the other day. We were listening to some musicians that were talking about what their life during COVID was, and our life wasn't all that different because we still had sick dogs and sick cats to see. So we went out of the house every day and we treated them every day, and we had clients in and out of the office every day. But pregnancy is a just it's just something you've got to be really careful during, but you have to be somewhat reasonable as well. I mean, there's a limit to how crazy you can get without making yourself insane. So those are some thoughts. And I've had clients go to dog
shoes off
shows.
is one of my. If I've got a pregnant bitch, you don't come in my house with your shoes on. I mean, that's just like a thing.
That's easy. They make foot baths, but nobody has a foot bath at their house. You're only going to have that at a commercial kennel. But just take off your shoes or give your friends little booties to put on when they come to your house if you're really, careful. Don't let them wear their shoes and put booties over them because I don't trust the booties. But if your friends don't want to walk in your house barefoot, then, give them those little things that the realtors give you at the door. So it's all fine. And don't wear your outerwear into the house. Take your jacket off outside and wash your hands with soap and water. Not those alcohol things. You want to wash with soap and water to remove any organic material and to really kill any viruses, bacteria, parasites that you might be bringing in. So those are some basics of what to do. So herpes is pretty characteristic on postmortem for puppies. Brucellosis is not. And just be aware, brucellosis can end your breeding program forever because you don't control what happens. Your state veterinarian can lock you down. And in many states, it's not every state, but most states, it is reportable. So if you have a test that goes to the lab, it comes back positive, the veterinarian is going to knock on your door. You'd better know what you're doing and what you're in for because it will change your kennel forever. So be aware of that and be careful that you don't do something by being complacent and fail to test.
Mm-hmm. And so is there any way to, I don't want to get a negative test, so I will never do this. I'm never going to expose my bitch or my dog to brucellosis, so I'm never going to do this. That's not a real thing, right?
Not really, because it can happen pretty easily. So just it's not highly contagious dog to dog, but it is contagious. So just, be aware that you can go to the dog show and if your dog walks through urine and licks their feet or, licks something that another dog was around, you've got to be careful. If you're using your dog as a teaser bitch, you could pick it up from the stud dog if he licks her. So, just be aware that those things are always a risk and you want to be thoughtful about it.
Yeah. Okay, guys, that was kind of a heavy one, kind of a hard one, but it needs to be talked about. And as I said, I know it's been talked about on this podcast before, but no harm in doing it again. So thank you, Marty.
Yeah. Well, find a veterinarian that's willing to work with you as a breeder, that's willing to do these things for you. And if you can't work with one, cultivate one. Find a new graduate, cultivate them, and get them on your page because it's really important as a breeder that you have a veterinary team member that is willing to work with you. So do your due diligence and find somebody good.
Excellent. All right, Marty, thank you so much. As always, I appreciate you tremendously.
Thank you.
For everybody that just needs to have a double dose of me and Marty, the Marty and Laura show drops on Wednesday.
Yeah, but it's a lot more fun and it's a little bit lighter. And
it is a lot lighter.
But it's so good for the people who are buying puppies from you. It will save you untold hours of explanations. So send the people there. Makes your life better.
We get to talk about cats on the Marty and Laura show. So you get to see Marty blow up my head because I don't know anything about cats. So it's fun. It's fun. Watch Laura's mind explode.
Yeah, multiple times.
Oh my God. All right. Thanks, Marty. Have a good one.
Yep. Bye.